Bismillahirrahmanirrahim. Assalamu alaikum participants and doctors. Myself, Mohammad Asim Hussain, working as product manager in Genix Pharmaceutical. Dear doctors, welcome in webinar session on behalf of Genix Pharmaceutical Management. Genix Pharma was founded in the year 2004. We have vision to help and provide top quality and affordable medicine for all those in need. Genix is being one of the fastest growing company in Pakistan pharmaceutical arena. We are remain committed to improving life of Pakistan's people associated with us at all level because we are dedicated to good health. We are working on different educational session. Today our session is a part of educational activity and presentation topic is the role of lacosamide in epilepsy add-on can be viable option, presented by well-known consultant neurologist Dr. Bashir Ahmed Soomro. This is the series of different lectures on different topics. Dr. Bashir Soomro is sharing. Dr. Bashir Soomro is head of Department of Neurology and Neurophysiology in Dr. Zia-ud-din Hospital, Karachi. He is professionally very busy person, but always available for education. Thank you so much, sir, to join us. Dear doctors, if there is any query, please drop your question in chat box. Question answer session will be after presentation. Over to you, sir.
Thank you, Asim. Bismillahirrahmanirrahim. Epilepsy management and its diagnosis is challenging always. So once you label somebody who is epileptic, you have to be careful about the diagnosis and you have to be sure about the diagnosis and you have to treat them accordingly with the medication which is indicated in the type of epilepsy. To briefly to discuss with you epilepsy, role of lacosamide is very important to tell you about the epilepsy management program. So seizure versus epilepsy, how it is differentiated between the seizure and epilepsy. The seizure is an abnormal jerky movement or abnormal synchronous focus which is generated by the brain, and when it discharges towards the epicenter, it is spreading to all over the brain. So once if it is diagnosed as a focal epilepsy, any part of the cortex, including the frontal, including parietal, or including occipital area or temporal area. The frontal and temporal areas are the main areas where somebody who had a focus which is generated discharges can lead to focal epilepsy either, or they can spread out to the other area of the brain and they can give you the seizures. So somebody who is having a recurrent seizures apart from a time duration more than 2 times, he can be labeled as an epileptic. So epilepsy is a disease which is spontaneous recurrent seizures associated with recurrent seizure, and it is a chronic form of disease. So this cartoon is showing you the focus epilepsy. The focal seizures can be it can be just a wandering, it can be bubbling, it can be confused speech, or it can be a chewing. These form of seizures can be labeled as a focal epilepsy. When the generalized seizure are generalized seizures, they generated from this thalamus area, and they spread out to the brain towards the all cortexes. It can lead to the generalized epileptic discharges, and it can be in generalized epileptic seizures. So they have a tonic-clonic seizures, or they can have stiffness of the body. They can present with the shaking of the body, and these are the tonic-clonic seizures. So development of anti-epileptic or anti-seizure medication, which was invented in 1850. The bromide was the one medication which was invented, and simultaneously when years progressed, the phenobarbital was invented, and then after 1930s, so many medications like first generation, second generation, and third generation medications have been evolved. So after the 1970, it went up. It went up into the third generation. So there are so many medications which are labeled as the first generation, and the medications which are labeled as the second generation. And this lacosamide, these are the medications which are third generation. Rovacetam is a third generation medication, and in between there are levetiracetam, topiramate, oxcarbamazepine, lamotrigine, zonisamide. These are the third generation, and the second generation medications are available, but sometimes they are not available because of the side effects. Or the mode of action is actually selective of the uh, channels. These are the few channels which are shown on this cartoon, and it's showing you sodium channel. Voltage gated channels are activated by the phenytoin, carbamazepine, and levetiracetam SV2 channel is used, and the benzodiazepine. These are the various channels where the anti-epileptic medications they act on, and these are the few medications like sodium channel, which is a very well-known voltage gated. Lacosamide also act here. So these are the sodium channel blockers. So lacosamide was actually it was invented by the bio team, the chemical, and they synchronized and the derivatives which was derived from this, and they synthesized it, and it was found as a lacosamide. Lacosamide is the first anti-seizure medication to selectively enhance the sodium channel slow inactivation, just distinct from traditional sodium channel blocker. Lacosamide inhibits the repetitive firings of the neurons characteristic of epilepsy through selective enhancement of sodium channel slow inactivation. This is advantageous in that it appears to reduce the long-term availability of the sodium channel for activation without affecting the physiological activity. So this is a cartoon which is showing you sodium channel. So lacosamide clinically development included 3 placebo-controlled double-blind randomized trials conducted in more than 1,300 patients, each demonstrating safety and efficacy of the lacosamide as compared to the placebo. So these are the few trials which has been conducted. And these are the trials monograms which is showing you. So the lacosamide showed very good results in patients who are using lacosamide in various doses, especially slow titration. We start with the 50 milligram and titrate up to the 600 milligram per day. Okay. So these are the various trials which is showing you. So the lacosamide has a well-characterized and favorable pharmacokinetic profile, including fast absorption rate, minimal or no interaction with cytochrome P450 isoenzyme. It's a low potential for drug-resistant interaction and low profile for the side effect. The main side effects are dizziness, headaches, sometimes diplopia, and sometimes vomiting. The word of caution is to use when using in cardiac patients. So be aware of the side effect. It can lead to the cardiac dysrhythmias also. So this is a cartoon which is showing you. So lacosamide is indicated as an adjuvant therapy with anti-epileptic medication to reduce the seizure frequency. So it can be used as a single or monotherapy, but the main FDA approval is on the add-on therapy. So you can add on the therapy in patients who are resistant to the focal epilepsy. So lacosamide is an adjuvant FDA approved medication for focal seizures. And it is available in syrup form, it is available in intravenous form, it is available in the tablet forms. And there are various titrating medication dosage, like it is available in 50 milligram, it is available in 100 milligram, 150 milligram, and 200 milligram, but it can be used up to the 600 milligram per day. Thank you.
Thank you so much, sir, for your wonderful presentation. Sir, please share your personal experience while using this Lalap, and what is the risk factor where you are considering while using Lalap?
Lacosamide is a very good adjuvant therapy. I do use in my refractory epilepsies, and it is very good in pediatric population as well as in adult population. And I have a very good pool of patients who are using the lacosamide. And lacosamide is contraindicated where some cardiac issues, in especially the elderly patients who are. But few of my patients, they have reported severe headache after using the lacosamide. Otherwise, it's a very good medication. I do use in refractory epilepsy, those who are not responsive to the classical medications, especially into the pediatric population. I have very good results of lacosamide.
Thank you so much, sir. Sir, what is the difference between lacosamide and other anti-epileptic sodium channel blocker mode of action, considering it inhibits slow inactivation of sodium channel? Is there any advantage or fast inactivation?
Basically, the I showed you the sodium channel medications which are acting on the sodium channel. As there are so many medications, especially the phenytoin, carbamazepine, oxcarbamazepine, which is available, and this is also lamotrigine and lacosamide and zonisamide. This is the channel which I was showing you. These are the classical sodium channel, and these are the time-tested medications. But the beauty of this lacosamide is it acts as a very quick, fast in the on the voltage gated, and they show you very quick response to the medication.
Sir, second question is that is lacosamide is superior than valproic acid? What is the basic difference of valproic acid? And what are the benefit of lacosamide over valproic acid?
Valproic acid is a different medication which has a different mode of action. Okay, and the lacosamide is a very different medication, and it is used in pediatric population because they both have a different mode of actions. So I think in third generation the lacosamide is superior because of the side effect profile, because sodium valproate has a various side effects, especially the hepatic degeneration or hepatic failure or hyperammonia because of the use of valproate. And there are long-term side effects of sodium valproate. So we cannot compare the lacosamide with the sodium valproate because both they have a different mode of actions, and the side effect profile is very different.
So
I
what
think this lacosamide is a superior as compared to the sodium valproate.
what age pediatric population can be given lacosamide?
All pediatric population seizures of unknown origin, you can use safely this lacosamide, the safer medication. In the syrup form, it is available also.
So slow inactivation and fast activation of sodium channels. What are your preferences while treating epilepsy? Which is your go-to drug or for focal?
You see, epilepsy is a chronic disease. You have to treat them very fast. So if somebody who is using lacosamide, it acts very fast. Okay.
Thank you so much, sir, for your wonderful presentation. We have covered all questions. And thank you
Okay.
so much, sir. You have very busy schedule, sir. You are always available for education and for lectures, sir. Sir,
Thank
you
you.
shared your routine and just come back from your hospital in Zia-ud-din and started this session, sir.
Thank you so much.
Thank you so much, sir. Thank you.
Thank you so much. Thank you.